Hello and welcome. Today we're diving into global developmental delay, or GDD. This term describes a significant delay in a child's development across multiple areas, impacting their abilities in ways that set them behind their peers. Understanding GDD is the first step in supporting these children and their families. So, what causes GDD? The answer is complex. In many cases, the exact cause remains unknown. However, GDD can stem from a variety of factors. These include genetic conditions, such as Down syndrome or Fragile X syndrome. Problems during pregnancy, like infections or exposure to toxins, can also play a role. Premature birth, complications during delivery, and metabolic disorders can all contribute to GDD. In some cases, environmental factors like severe neglect or malnutrition may be implicated. The pathophysiology of GDD is equally complex and varies depending on the underlying cause. Essentially, something is disrupting the normal development of the brain and nervous system. This disruption can affect neuronal growth, migration, and synapse formation, leading to impairments in cognitive, motor, social, and adaptive skills. Specific brain regions affected will influence the type and severity of the developmental delays. Regarding epidemiology, GDD affects approximately 3% of children under the age of 5. It's more commonly diagnosed in younger children, as developmental milestones become more apparent during these early years. Because GDD is a descriptive term, the prevalence can vary depending on the diagnostic criteria used and the population studied. It's important to note that this is a broad diagnosis, and further investigation is often needed to identify any underlying specific conditions. The signs and symptoms of GDD are diverse, reflecting the range of developmental areas affected. Children with GDD may experience delays in gross motor skills, such as sitting, crawling, or walking. Fine motor skills, like grasping and manipulating objects, may also be delayed. Speech and language development are frequently affected, with difficulties in understanding and expressing themselves. Cognitive delays can manifest as difficulty learning, problem-solving, and understanding concepts. Social and emotional delays may be evident in difficulty interacting with others or managing emotions. Adaptive skills, such as self-care skills like dressing or feeding, may also be delayed. Diagnosing GD typically involves a comprehensive assessment by a team of healthcare professionals. This often includes pediatricians, neurologists, developmental specialists, psychologists, and speech and language therapists. The assessment involves a thorough review of the child's medical history, physical examination, and developmental testing using standardized assessment tools. These tests evaluate the child's abilities across different developmental domains. It's important to remember that GDD is a clinical diagnosis, meaning it's based on observed behavior and test results, rather than a single definitive test. While GDD isn't categorized into specific types in the same way as some other conditions, it's helpful to think of it in terms of the areas most affected. For instance, a child might have primarily motor delays, primarily language delays, or a more global delay affecting all areas equally. The severity of the delay can also vary greatly from mild to profound. Understanding the specific profile of delays is crucial for tailoring interventions. Treatment and management of GDD is multidisciplinary and individualized. Early intervention is key. This often includes therapies such as physical therapy to improve motor skills, occupational therapy to enhance fine motor and adaptive skills, speech therapy to address language and communication difficulties, and behavioral therapy to support social and emotional development. Special education services can also be beneficial. The goal is to maximize the child's potential and improve their quality of life. Medication may be used to manage specific symptoms or co-occurring conditions. Unfortunately, there isn't a way to completely prevent GDD in all cases, as many causes are beyond our control. However, promoting healthy pregnancies, providing good prenatal care, ensuring safe deliveries, and addressing environmental risk factors like malnutrition and exposure to toxins can all help reduce the risk. Genetic counseling may be beneficial for families with a history of genetic conditions. The prognosis for children with GDD varies widely depending on the underlying cause, the severity of the delays, and the availability of early intervention services. Some children may eventually catch up to their peers, while others may continue to experience developmental challenges throughout their lives. Research is ongoing to better understand the causes of GDD and develop more effective treatments. Recent advances in genetic testing are helping to identify specific genetic conditions that contribute to GDD, which can lead to more targeted interventions. Additionally, research into brain plasticity is exploring ways to promote brain development and improve outcomes for children with GDD. Remember, early intervention and ongoing support are crucial for maximizing a child's potential and improving their overall well-being.